During gait assessment, you notice a client's right foot consistently points outward when stepping forward. Me. You see that? Have you seen that Charlie Chaplin walk from people? Wink. Which group of hip muscles is most active when producing this movement? And what role do they share when working bilaterally? So we're imagining unilaterally and bilaterally. So when a hip muscle works unilaterally, that means it's only moving one leg. And when the hip muscle is working bilaterally, it's working on both sides of the hips. So when they're both right and left are working together is what we're asking for. So let's look at the question. One foot is consistently pointing outward. So imagine the whole leg, because we're looking at a hip muscle. We're not looking at foot eversion. We're looking at a hip muscle that might be causing this whole outward turn. So imagine this is the hip and it's causing that outward turn. So what is causing external rotation or lateral rotation of the hip? So we're imagining the placement of all the muscles around the hip, and we're going to look at our choices. Gluteus medius and minimus, and they also share, when they're working bilaterally, hip abduction. Well, yes, bilaterally they will abduct the hips. Gluteus medius and minimus is all about hip abduction. So yes, if you're laying on your back, you can open your legs, and that would be glute medius and minimus engaging. Then we have B, adductor longus and brevis. Adductor would be on the insides of the legs. They help with hip abduction. You could squeeze your legs together. Bilaterally, your legs are going to go together. Piriformis and the deep rotators, stabilization of the hip joint. So you can imagine those deep hip rotators. If you engage them, your hip is getting really firm. That would be stabilization of the hip joint. What else do? They turn that hip laterally. That's what we're looking for. And then D, rectus femoris and sartorius, which is hip flexion. They help to, rectus femoris helps to extend the knee, but it's not all about rotating that hip outward, which would make that foot turn outward. So we're looking at the best possible answer would be C, piriformis. The other ones just don't make sense for turning the foot outward. Last question. You observe a client rising from a squat. So imagine they're squatting down. Having a vivid imagination is going to help you so much with the MBLEx.